Thank you, Mr Deputy Speaker. I'm very pleased to speak about nurses and to respond to this MPI, which really is a flimsy MPI. And I think the Minister for Health really got to the motivation of this MPI, that we have the Nurses Union is in town and they say jump to the Labor Party and the Labor Party says how high. And what I am reminded of as a new candidate, I remember being invited by the Secretary of the Australian Nurses Federation to come and discuss the conditions at Flinders Medical Centre Hospital. And it was really a stunt. She invited the local state Liberal MPs, invited myself, and what we heard was this place was the most terrible place you can actually imagine. And I remember at the end saying, well, look, I actually work there, and this just doesn't really reflect in any way the conditions at that hospital. And you can imagine my surprise, Mr Deputy Speaker, when the Secretary of the Nurses Federation emerged some months later as the Labor candidate for Adelaide. Sadly, she did not win Adelaide, and at the next federal election she emerged as the Labor candidate for Macon. Sadly, the voters of Macon didn't support her then, and it was realised that Gal Gago, the Secretary of the South Australian Nurses Federation, and voters didn't really get along, so they tucked her away in the Legislative Council, and she's but it really is an example, I think, of how poorly health workers have been represented by some of these unions. We saw a really good example of this with the Health Services Union, the actions of those officials. But seeing as we talk about nurses, what I'd like to focus on is the development of practice nurses. And this has been a very proud initiative, which was really pushed forward by Michael Wooldridge as the Minister for Health and Ageing. And you now find that almost every general practice has a practice nurse, someone who has trained as a registered nurse, and what this does is enable, it actually provides more capacity in primary care. It means in areas like diabetes, chronic disease management, asthma, all sorts of things, the practice nurse can focus on certain things and allow the general practitioner to focus on diagnostics. It's been a great development. We've seen it happen around the world, and it happened in Australia under a Liberal government. And what we also saw when Tony Abbott was the Minister for Health was an expansion through Medicare using the practice incentive payment that was under Wooldridge, but also using the team care arrangements and an expansion of Medicare there. And you can imagine, I mean, the Labor Party have talked a lot about nurses, but what they haven't mentioned is that they wanted to pull out $437 million from Medicare, which was going towards practice nurses. And that was something that then opposition opposed. And in our policy, we made it very clear we will protect and maintain the $437 million of support for practice nurses that the Rudd-Gillard government plans to strip out of Medicare for these services. So we've heard a lot of rhetoric about nurses, but when it actually comes to substance, we have the runs on the board, and practice nurses is a great example. But it doesn't just stop there. We also have initiatives to provide scholarships for nurses, and $13.4 million for 500 additional scholarships for nursing and allied health. And this will be for a maximum value of up to $30,000 per scholarship. And so what we also see, the majority of nurses employed in Australia are employed in acute care settings in hospitals. And we are increasing the hospital funding to the state and territory governments every year. It's 6%, 9%, 9% over the forward estimates. And we're providing more than $5 billion in additional hospital funding to the states over the next 4 years. So when you look at the scholarships that are available for nurses, when you look at the practice nurse incentives, when you look at the funding that's going to hospitals, this MPI just doesn't stack up. It really does come down to the underlying motivation, which is the industrial arm of the Labor Party muscling the political arm of the Labor movement, and that is the Labor Party and the opposition in this place. We have had a number of nurses represent us. Trish Worth, Trish Draper, great members.
Members' time has expired.